Does eating red meat cause type 2 diabetes? Welcome back to another Dr. Westman Reacts video. If you don't have my top 10 tips on how to start keto right, please look in the description below. Well, it was in the news again recently that red meat causes type 2 diabetes and everything else bad in the world. Again, you have to just do a little primer on the ladder of evidence-based medicine and realize that this world announcement, again, was based on what's called observational or hypothesis-generating research. And if you look carefully in the news and what people say, that's basically what they say when they're really caught on what to say. So red meat consumption associated with increased type 2 diabetes risk is the name of this article. It doesn't say it causes it, right? Because you can't, because it's not an experimental study. Now, I've talked about nutritional epidemiology and epidemiology in general. It's a field that typically gives you the incidence or how often something happens. So if someone asks what is the rate of obesity and type 2 diabetes in the U.S., epidemiology categorizes people and finds the rate of people. But you can also categorize and stratify, let's say, if so many people in a town had cholera and you put on a map that most of them were clustered in this area and you found that there was a water pump that was right in that area around this cluster of cholera, and cholera is a water-borne disease, you could take the pump handle off and fix the cholera, stop the epidemic, and that's really one of the starting stories of epidemiology, that they figured out through geography that the cholera epidemic came from this one water source. And because it stopped immediately, they knew that was the cause. It's great detective work. So now when it comes to nutritional epidemiology, I'm afraid it's not so clear. And I would like to call out a friend of mine, or I think I call her a friend. We've been to meetings together, and Zoe Harcum is a scientist in the UK. I subscribe to her newsletter and her information, Zoe Harcum, and she wrote a wonderful expose, if you will, on nutritional epidemiology, and this paper in particular that just calls out all of the different elements of science that are not found in nutritional epidemiology. So the study that came out in the news release, this is from Harvard. So of course, if it comes from Harvard, that automatically says that it has all of this cachet behind it. But careful, it doesn't mean it's great science. When you think of the physiology that eating meat would cause type 2 diabetes, it actually makes no sense. Because I have people in my clinic who eat meat and measure their blood glucose, and the blood glucose doesn't go up. So type 2 diabetes is an elevated blood glucose. It's not just some bizarre thing that you call diabetes, it's an elevated blood glucose. When a doctor diagnoses you with diabetes, they measure the blood glucose. In fact, I will ask people when they come in, what is diabetes? And they'll say, well, it's the pancreas. No. The doctors aren't measuring the pancreas when they diagnose you with diabetes. They're measuring the blood sugar. In fact, 100 years ago, the Osler textbook of medicine, I have a little show and tell in my office, the treatment for type 2 diabetes was a diet with mainly meat. And that was to reverse the elevated urine glucose because they couldn't even measure the blood glucose then. So the physiology, this makes no sense, that eating meat would cause diabetes. But wait, if the methodology is imprecise, so that, let's say, the meat is being categorized inside a hamburger. So if someone eats a hamburger, they get a score for red meat, when it's not just the red meat. So typically on these food frequency questionnaires and asking people what they eat and how much they eat, I mean, that's fraught with lack of accuracy and precision. But the idea that the burger is raising the blood glucose, it's not the hamburger, it's the bun. It's the bun, the fries, and the sugar in the drinks, or tea in the South, also known as sweet tea, but it's tea until otherwise, sweet tea until otherwise proven. In fact, they call it unsweet tea, normal tea here in the South. So hamburger doesn't, in and of itself, raise the blood glucose. You can get a CGM. These are called Libres or Dexcoms, and you can measure your blood glucose, the blood sugar, after eating things, and you can see that the hamburger, the meat itself, red meat, doesn't raise the blood glucose, or if it does, it's a very small amount. You eat a burger with the bun, you eat the fries, you eat the potato, pasta, rice, all that, the carbs, and the blood sugar goes way up. So the biology is not here, and that's just one tick against the conclusion here. There should be some rationale that's sound in terms of the physiology. And so the idea that you will ask people what they eat, follow them over time, and then compare those who have disease and those who don't have disease, we're making I think the false assumption that if you change what you ate to what the other healthy person ate, then you wouldn't have the problem. So one of the fatal flaws of nutritional epidemiology is if we just all ate like what healthy people ate, we'd all be healthy. Well, that says nothing about the underlying risk toward different diseases. So that idea, I've fallen out of. Otherwise, I'm just saying that this is hypothesis generating research, and even if it comes from Harvard, this study does not say red meat causes type 2 diabetes. It says it's associated with it, and even then, the association is so small that the Bradford Hill criteria that are used to see if epidemiology studies might be anywhere near causation, the relative risk is so small, no one outside nutritional epidemiology gives it credence that it's not clinically relevant. So there's statistical significance, but not clinical significance. So the detail of this, again, is in the paper or the review of the paper by Zoe Harcum. And it's almost like I would use this paper as a case study of how not to do science, so that it's not experimental. It's association, not causation. In fact, they also use the relative risk in their claiming that it's important rather than the absolute risk, so that the risk, if there is one, is so small in absolute terms, they use the relative risk. This is a classic sleight of hand of statistics that drug companies use to say their drugs are really, really powerful when they're not. They're using the relative risk. So it's another fascinating use of limited data, but trumpeted by people, vested interests who don't want you to eat meat. And I think there are well-intentioned epidemiologists who just don't understand that what they do does not really have clinical relevance. I mean, and that would be tough for someone who spent their whole life doing this to then be told that that work doesn't have validity. Well, it might, but it has to be subsequently tested in randomized controlled trials. I've talked to these nutrition epidemiologists, and they claim that we can't do randomized trials. It's too hard. That's not true. With the internet today, with the ability to take pictures and have apps and collect information, we can do randomized trials of diet. We could randomize people to eating meat or not meat, or 2 servings versus 4 servings, or 1 and randomize them and see if there are differences in the rates of type 2 diabetes. So that's the paper I would like before I'm going to sign off that red meat causes type 2 diabetes. I want a randomized trial, a prospective study, giving people different amounts of meat, and they don't have a choice. They get randomized, meaning, if you're in the study, you're going to agree for that 5-year period to eat some, 2 servings a week. Or compare it to the carnivores who are eating only meat, perhaps, and see what the rates of diabetes are. By giving people red meat, I can reverse type 2 diabetes. That's how ludicrous the claim is here. to me that red meat causes type 2 diabetes, or, well, wait, it's just associated with type 2 diabetes, but it could be that in the context of carb eating, so this is again apples and oranges, in the context of carb eating, if you're eating the meat with the bun, with the bread, with the potato, with the dessert at the ranch, the steakhouse, then you might actually have that association, but the red meat outside that context does not cause type 2 diabetes. And I guess, would you have an asterisk at the bottom of this paper that this says this might not apply to you if you don't eat the typical American diet? And that, I think, would be the appropriate conclusion, is that if you're not eating that way, even if it did have that result and it was causative, you will probably not have those same results if you're just eating meat without all of the carbs. So eating meat does not raise the blood glucose. It's the carbs that raise the blood glucose, and the idea that you can reverse type 2 diabetes might be something new to you. I do it on a daily basis in my office, so do other keto and even obesity medicine doctors now with diet, prescription strength diets or medications. You can reverse type 2 diabetes, and my most happy patients are those who not only are no longer injecting insulin, they're no longer having to measure their blood glucose because they no longer have type 2 diabetes. And I ask people to eat meat. So sorry about this one, still not causative. In fact, Zoe Harcum pulled out a classic line from a surgeon in the UK, Dr. Cleve, and Dr. Cleve said, "For a modern disease to be related to an old-fashioned food is one of the most ludicrous things I've ever heard in my life." So check out Zoe Harcum and her blog. It's fantastic. And don't worry about eating red meat. I'm Dr. Eric Westman. If you don't have my top 10 tips on starting keto right, please look down below. And if you like this video, please like, subscribe, and if you haven't sent it to a friend, please do. This is a grassroots movement, and this particular issue went everywhere, so we need to get the right information out. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.